members way back when we had that first roundtable. We called on law enforcement, the medical community, our county and municipal officials, drug treatment providers, and concerned citizens to talk about the issue at hand, prescription drug abuse, and in particular, opioids. Indeed, what we found was that, like a lot of other communities in the U.S., ours were suffering from the scourge that was prescription opioids. In short, a great many of our residents were struggling with addiction, living sicker, and dying prematurely because of it. Soon after that roundtable, as part of the 2009 Community Health Assessment, substance abuse, specifically prescription drug abuse, was deemed a priority health issue for Moore County and has remained a priority health issue over the last 12 years. For those that don't know, a community health assessment is a requirement of all North Carolina health departments every 4 years. Community health assessment enables local public health officials and communities an opportunity to identify factors that affect the health of our community and determine the availability of resources to address them. Early on, our efforts focused mainly on helping to curtail the sheer volume of prescription drugs that were in circulation. At one time, around 2012, 2013, there were over 6 million prescription pills prescribed in Moore County, which translated to roughly 60 pills for every man, woman, and child living in Moore County at the time. In response, we began promoting prescription drug take-back events like Operation Medicine Drop, where citizens can drop off their unused or expired medications and have them safely disposed of by law enforcement, essentially taking potentially harmful medications out of circulation. Out of that came permanent prescription drug drop boxes, where residents can dispose of their unused or unwanted medications anytime. Moore County has 4 of those drop boxes that are still in use today across the county. Through these drop boxes and take-back events, we have been successful in taking millions of potentially harmful doses off the streets and out of medicine cabinets. Another early effort was to promote responsible prescribing practices along with the consistent and sustained use of the NC Controlled Substance Reporting System, or CSRS, by our county medical providers. Through its use, prescribers can audit their personal controlled substance prescribing history and identify individuals that may be in need of referral to substance use disorder services. We have since worked with our medical community to make ourselves better equipped to address those who are facing those substance use disorders. One of the central figures in our efforts here in Moore has been Drug-Free Moore County. Drug-Free is a 501c3 nonprofit whose mission is to be a positive influence in preventing and combating substance use disorders in Moore County by increasing awareness, disseminating information, and garnering community support towards healthy choices and recovery. Drug-Free has been around since the late 80s here in Moore County. I have the honor of currently serving as the chair on the board of directors, originally chartered as a task force by our Moore County commissioners to study and take action on drug issues in 1989. Which, as most of you recall, was heavily revolved around the prevention and education of the Reagan area, the Just Say No movement. The organization has since grown by leaps and bounds, evolving over the years from focusing mainly on prevention education to focusing on treatment and recovery for individuals and family living with substance abuse issues. Principal among Drug-Free's most recent achievements, happy to say that last year Drug-Free was able to open a community recovery center. The first of its kind here in Moore County. The center, Moore Recreations, is located right here in our county seat in Carthage on Barrett Street, just adjacent to the county courthouse. And it serves all of Moore County in helping everyone who might be seeking recovery resources. The aim is to be a safe, welcoming environment for any person or family member who is struggling with substance use disorder to find support and information for their healthy recovery journey. Drug-Free Moore County also offers several other key services, all free of charge to the public. That is distribution of harm reduction kits, which includes naloxone, links to recovery resources, information on HIV and Hep C prevention and treatment, safe syringe program that runs weekly. Work in our Moore County Detention Center, which involves the Helping Women Recover and Helping Men Recover program. It's basically an education and recovery program where staff goes in and works with that inmate population that may be suffering from addiction issues. One of the things that we found with that inmate population is roughly about 4 out of every 5 suffers from some sort of substance abuse issues. So those programs are a great need among that population.